In recent decades, healthcare has become a black box. Every year, your insurance company or HMO comes to you and says, "This is the price, take it or leave it." It's time to open the black box and see where the money is going. If you Google Medicare fraud, you will get almost 2 million hits. If Medicare has problems, why would we assume that the private system is okay? We know it isn't. About 15 years ago, one of my aunts died in a famous healthcare facility. After she died, her family received a large bill for her final care. Her daughter, who was in the business, went through the bills and identified $50,000 worth of improper charges. In addition to potential fraud, it is possible that the healthcare industry has fallen into high-cost ways of doing things. A few years ago, I was having a problem with an ear infection. My GP recommended that I see a specialist. When I called the specialist, they told me that I had to have an audiology exam before I saw the doctor. I was not complaining of hearing problems, and I think this is an example of protocols that add to costs without increasing the benefits. As another example, another woman I knew was diagnosed with multiple sclerosis. When she returned from a special clinic, she had a collection of expensively produced 4-color brochures. These brochures essentially said that they would be glad to work with her, although they really couldn't do much about her problem. For 10 years I worked in a manufacturing company, and they knew how much every nut, bolt, and minute of labor cost them down to the tenth of a cent. If healthcare organizations don't know this, they should. To this day, no one has explained the $25 aspirins that hospitals deliver. Healthcare has been a golden goose for some people and organizations for quite a while. This era is coming to an end. After years of being pushed and pushed by insurers and providers, many corporations are starting to self-insure for healthcare. The companies with the largest budgets for healthcare are leaving the HMO PPO system. We are returning to a fee-for-service model, and providers will be forced to compete on price and service. Healthcare is the #1 domestic problem, and after years of deregulation, we are entering a new age of regulation. The apostles of the so-called free market have once again demonstrated that, left to their own devices, some capitalists will form monopolies and gouge consumers.